Bag initiative is a scheme that's been launched riding on a project from Sutton. They did a pilot to look at the length of stay of residents in nursing homes following or during a hospital admission. The average length of stay as a result of the Red Bag was reduced by 4 days. So obviously Dorset was keen to try and implement this within our area. The aim of the Red Bag is to reduce length of admission, but also to improve the communication between the nursing home and the hospital itself. That will improve the patient's journey and get them back to the place they want to be, which is home. And how that works is the nursing homes have been given the Red Bags, and if a patient deteriorates at any time and an ambulance is called, this acts as a communication tool. All the information about that patient is put into the Red Bag. This then goes with the patient in the ambulance to A&E or to whatever environment they're getting admitted to. And this basically improves the communication by telling the staff what is the patient's normal, what is the patient able to do with regards to cognitive function, mobility, eating and drinking, what their resus status is, and what their expectation is about their hospital admission. So when the patient arrives in A&E, the ambulance crew will hand over to the A&E staff that they have come from a nursing home and will give them the Red Bag. Within the Red Bag there is a checklist confirming what information is in it, and that would be the patient's details, which sometimes is a passport or a care plan, and the communication tool that's actually stating why they've been brought in the first place. This then gets ticked off by the A&E staff to say that they've received it and this information is present in the bag. The bag will stay with the patient. Depending on where they then get moved, whether it's to another ward or back home or theatre, the bag will travel with them at all times. And this is particularly important in this day and age because patients move around the whole time in hospital. They never go to the ward that they initially need to be admitted on. So this means that all the documentation stays with the patient, and the staff from the ward, whether they be occupational therapists, physios, doctors, nursing staff, dietitians, can add to that information. So all their findings and any other communication can go in the Red Bag, and then that will go back with the patient once they're discharged home. If the staff are on board with this and are actually improving their skills with regards to identifying a deteriorating patient, means that we can either stop them going into hospital, or if we have to get them into hospital, this tool will mean that they don't have to stay there for such a long time. What's made me most proud is the fact that we've collaborated with the nursing homes. It's actually given them an insight what I do, what the role of the district nurses do, but also how proactive Dorset is